Welcome back for the last part of the medical history taking. This is part 3. The objectives for today: the student will be able to perform a 3-generation family history, describe the elements of the social history, and list the review of systems. Family history. Family history is very important. It allows you to identify if there are inherited or genetic conditions that might affect your patient. It might actually alter your treatment plans or your management plans for the patient. For example, if you know that a patient of yours has 2 first-degree family members with breast cancer, maybe their mother and their sister, and you know that they were both diagnosed in their 40s, that's going to change the time in which you actually start screening for breast cancer in your patient. It might also change the frequency with which you do it, or even the modalities you choose to screen your patient. So family history is very important for that reason. Remember, at this point, you've asked the identifying data, chief complaint, the history of present illness, the past medical history, medications, and allergies. You always want to start with a transition statement when you start your family history. You might ask an open-ended question like, do you know of any medical problems that run in your family? Or can you tell me about your family medical history? When obtaining a family history, you want to include 3 generations. That includes grandparents, both maternal and paternal, parents, siblings, and any children the patient might have. What to include? You want to document the age of onset of a diagnosis. You want to document whether the family member is living or deceased, and you want to know the cause of death for that family member and the age at which they died. Additional questions you might ask are to review common conditions, just like you did for the past medical history. You're going to ask about diabetes, heart disease, high blood pressure, stroke, and cancer. And these are specific to adults. The pediatric history will be discussed in a different segment. You also want to ask about any conditions that might be related to the chief complaint. For example, if a patient came in with chest pain, you might want to ask if there's any family history of heart disease. This is just an example of how you can document the family history. Some people choose to do it in pedigree form, and others choose to document in a list, and we usually order it in terms of the eldest to the youngest. The family history is important also because it allows you to identify red flags. Red flags include the following: several closely related individuals with the same or related condition, much like my breast cancer example. A common disorder with an earlier age of onset than is typical. So that might be heart disease in a 40-year-old patient. Sudden death in a seemingly healthy person. And an individual or couple with 3 or more pregnancy losses can also indicate that there might be a genetic or inherited condition. So now I want you to watch me interview Peggy again. You're going to see the family history this time, and I want you to either document it using the pedigree format or write it in a list form. At the end of the video, you'll see how I documented it. So Peggy, now that I've learned a little bit more about your past health, I'd like to ask a little bit more about your family.
Okay.
All right, so can you tell me about any medical problems that run in your family?
My dad had and passed away from prostate cancer.
Okay.
And my mom had a stroke and passed away from the stroke.
Okay. And do you know how old they were when they passed
My
away?
dad was 78. My mom was 70.
Okay, and you said your dad was prostate cancer? Okay. All right. And do you know anything about your grandparents' health at all?
Well, my grandparents were both deceased, both pair, before I was born, so I just want to say natural causes.
Okay. All right,
I really
so it's
don't
not
know.
clear. All right. And do you have any brothers or sisters?
Yes, I have a brother.
Okay.
He's 58,
Okay.
and he has high blood pressure as well.
Okay. All right. Does he have any other health conditions
No,
at all?
no.
Okay. And you mentioned you had 2 kids.
hmm
How is their health?
Very good.
Okay,
Yeah.
great. That's good to hear. Okay. I'm just going to run through a couple common things just in case we forgot to mention anything. Anyone in your family have diabetes?
No.
And anyone else have any strokes?
No.
Any heart disease at all?
No.
Anyone else have high blood pressure?
No.
Okay. And any cancers besides prostate cancer?
No.
Okay, that's good. So that's good to hear your kids are healthy.
Mm.
So I think that, really the 2 things are prostate cancer and stroke and high blood pressure are the things I'm hearing.
Mm-hmm.
So now that I've found out a little bit more about your family history, I want to get to know you a little bit better as a person. Okay, so we're going to talk a little bit more about what a daily life for Peggy is.
Okay.
Next part of the history is a really interesting and important one. It's the social history. The social history really gets you to know the patient on a more personal level. It might influence the way you approach a patient's treatment plan or how you counsel a patient to make a behavior change. Many factors found in the social history influence the health of the patient. Some of these, just to name a few, are diet, exercise, smoking, and many others. The social history also clues you in to what kind of social support a patient has in their life, which is also important to know when you're treating a patient. Social history is typically written in paragraph form and really serves as the biography of the patient. The components of the social history are their current living situation, family and social structure, education and literacy, employment, financial concerns, safety and exposures, and health habits, which include diet, sleep, exercise, hobbies or leisure activities, smoking, alcohol, drug use, sexuality, gender identity, and any religious or spiritual beliefs the patient might have. When asking about the current living situation, you want to know where the patient lives, you want to know what their neighborhood is like, do they live in a house, an apartment, a condominium, and who do they live with? The family and social structure is also really important. You want to know if patients have extended family that are living in the area, do they have friend groups that they interact with, either at school, at work, or at church. Who is the patient close to, and how do they cope when they hear bad news or they have a difficult situation come up in life? You also want to ask about patients' education level and their level of literacy, and this can sometimes feel a little bit awkward. So some good examples for how to ask these questions would be to ask a patient how far they went in school or what they studied in school, what level of education they needed to do their job. You can ask them questions about whether or not they have trouble looking at written material or understanding advice given by doctors that's written. Those are all ways to assess a patient's literacy. You also want to know what a patient does with most of their day. So you want to know about whether or not the patient works outside the home or in the home. You want to know about how long they work. Is it part-time or full-time? Do they enjoy their job? What kind of jobs have they done previously? You also want to know about whether or not they're exposed to any dangerous materials while they're at work. Financial concerns are also important because they might affect how you prescribe medications or which medications you might choose to give the patient. So you want to know about any financial stresses or concerns. You want to know if the patient has health insurance or has any trouble paying for medications or their copays. Safety is always a big concern. And safety involves a lot of different realms for the patient. So you want to ask about safety at home. That might include things like carbon monoxide detectors and smoke detectors. I also like to ask if a patient has had any problems or interactions with violence in the past. This could be at home, within a relationship, at work. It's an important question to ask. In terms of child safety, you want to ask about things like child-proofing in the home, any gates on the stairs, water safety, car seats. You want to ask recreation things like, do patients wear seatbelts? Do they wear helmets when they ride their bike? Are they at risk for falls? Do they have a lot of throw rugs or poor lighting? That's specifically important for older patients. You also want to know if patients have any firearms in the house. I think the best way to start the social history is really to ask about a typical day for the patient. Once they walk you through a typical day, you can use pieces of information that they tell you to ask additional questions. When you're inquiring about the health habits of the patient, you want to know about their diet. And you might ask a patient to tell you what they ate for breakfast, lunch, and dinner yesterday, for example. You want to know about how long they sleep and whether or not they feel their sleep is restful. You want to ask them about exercise. Do they do any exercise? How long do they exercise for? What type of exercise do they do? You also want to ask them about their hobbies and their interests and what they do in their free time. You want to know about smoking. And remember, it's important not just to know if a patient is currently smoking, but if they've ever smoked in the past. If they tell you they have, you want to know for how long they smoked and how many packs a day they smoked for. You also want to know about alcohol use. It's important to know what type of alcohol, how often they drink, and the quantity of alcohol they drink per sitting. You want to ask about recreational drug use, either current or in the past. And I often find it's important to ask about prescription medications too, because this is becoming a large problem with drug addiction. It's also important to find out the patient's religious or spiritual beliefs and whether or not they use that for support or when they're dealing with a difficult situation. The sexual history makes a lot of people uncomfortable, but I always say if you look comfortable asking the questions, patients are going to feel comfortable telling you the answers. Okay? So you want to be really open about this. First start by asking if patients have any concerns about sex at all. Okay? You can ask if they're sexually active. You can ask about how many partners they've had in their lifetime or how many current partners they have. Are they in a monogamous relationship with their partner? You also want to know who the partners are. Is the partner male, female? Do they have partners of different genders? You want to know if they protect themselves from pregnancy. Do they use any methods to protect themselves from sexually transmitted infections? Have they had any sexually transmitted infections in the past, and how were they treated? These are all really important questions and very important to ask. About 20 to 64% of patients have sexual dysfunction, and most of them will not say anything unless you specifically ask. So it's a really important thing to ask about. Gender identity is also really important to ask about. You want to ask an open-ended question like, do you ever have any questions about your gender? Or how do you feel about your gender as male or female? You can also ask patients what pronouns they prefer to use when you're referring to them. So the social history is really comprehensive, and it really helps you get to know your patient. It really forms the basis of your relationship with them, and it's a really important one to ask. So get comfortable with it. You're going to now watch a clip of me interviewing Peggy and performing a social history. I want you to practice your documentation again and write down in paragraph form Peggy's social history at this point. You'll be able to see the answers at the end of the video. Okay. So Peggy, thanks for telling me a little bit about your family. I just want to get to know you a bit better, so I'm going to ask you some questions about, I'll start with, what is a typical day for you?
Well, I'm usually up about 6:30, have a nice breakfast, take my dog out, do a little walk around with him, come back in, have my breakfast, go up, take my shower.
Mm-hmm.
Then I will start my day. Since I'm retired, I have a variety of things that I'm involved in. I do some singing, I do some swimming, I read, I'm socially active with my friends, I belong on a couple of boards. So I keep myself pretty active. I'm usually home again and settled in about 5 o'clock, have my dinner.
Mm-hmm.
Then I will sit down and do whatever after supper. Knit, read, watch TV, whatever, and I'm usually in bed by 10:30.
Okay, that's great. So you have a very busy day.
Yeah, I'm busy. Sometimes I wonder how I worked.
Yeah. It's good that you could fill your time up with all of those enjoyable things. That's great. So if you go to bed at 10:30, getting up at 6:30, you get about 8 hours of sleep?
Yes.
Okay. Is your sleep restful?
Very.
Yeah? Okay, that's great. Good to hear. You mentioned you get up and walk the dog, which is excellent. That's great exercise. Do you do anything else for exercise?
I do belong to the Y, Silver Sneakers.
Okay.
And I go 3 times a week.
Great.
And the program usually runs about an hour.
Okay.
So it's pretty intense.
Okay. And what kind of dog do you have that you
I have a little rescue Chihuahua.
Oh, very cute. So you have a little tiny dog?
Yeah, so yes, he's a good boy.
Very nice. Okay. And you mentioned all the hobbies that you have, which is excellent. You said you eat breakfast and dinner. Can you run me through what your typical diet looks like?
Usually for breakfast I will have an English muffin with some marmalade on it and a cup of coffee.
Mm-hmm.
For lunch it's usually a salad.
Okay, very good.
And then at dinner time I usually will try to have my protein and my vegetable.
Okay.
And perhaps a salad.
Okay.
And sometimes I will have a little dessert. It depends what and I drink a lot of water during the day. I usually have my water bottle with me. So that's about what I usually eat.
Okay.
I mean, I try my best to maintain a healthy diet.
Very good. Do you do any other caffeine products?
I have 1 cup of coffee a day. That's it.
That's it. Okay. All right, great. So it sounds like you're eating a pretty balanced diet.
That's right.
Very good. And tell me a little bit about your living situation.
Well, I am a widow.
Okay.
My husband passed away 5 years ago.
Okay, sorry to hear that.
So I have a condo in a very safe adult community,
Okay.
and I'm there by myself with the dog.
Okay. All right. That's good that you feel safe in your neighborhood. You're able to walk the
Oh,
chihuahua
yes,
around.
yes.
Okay. That's good. What about inside the house safety measures? Do you have carbon monoxide detectors?
Yes, I do.
Safety, not safety, the fire
Fire,
alarms?
yes,
Okay.
yep. I
Very
have
good.
Everything. I
All right. Good.
feel
You have a lot
secure.
of throw rugs in the house?
No.
Or anything like that? No? Okay. Good. Firearms at all in the house?
Oh, no.
Okay. And just a general question, have you ever dealt with violence in your life at all?
No,
Never?
no.
Okay. All right. And what did you do before you were retired?
I was a school teacher. I
Oh.
taught special ed,
Oh, okay.
so it was very enjoyable. I
Very good.
really enjoyed it.
You like doing it. When did you retire?
About 5-6 years ago.
Okay. And what's your source of health insurance at this point?
I have insurance through my workplace
Okay.
still until I get to be 65, and then
Okay.
I go on Medicare and
Okay.
whatever.
Okay. Do you have any concerns about getting prescription medications or paying
No.
for your health care?
Nope,
Okay. What about any financial concerns at all?
nope.
No.
Very fortunate.
Very good. Okay. Good teacher pension. Very
Mhm.
good. And what about the amount of schooling you went through?
I
be a
had
teacher.
4 years of college
Mhm.
and then 2 years of a master's degree so that I could do the special ed.
Okay. That's great. And it was a very, very fulfilling career for you. That's wonderful.
Very.
Okay. All right. And I'm sorry to hear about your husband.
Thank you.
Said he passed away 5 years ago. Okay. And how did you cope with that stress when that first happened?
Well, I can't say that I wasn't sad,
Mm-hmm.
and I was probably very. I didn't want to believe what had happened. You know, he got sick and all.
Okay.
But I am a very strong practicing Catholic,
Okay.
and I have a great support system at my church,
Very good.
plus my children,
Mm-hmm.
and I have my brother, and I have a lot of friends where I live. So
Okay.
I think I was extremely fortunate that I had as much, nobody would just let me sit.
That's
It
good.
was, they kept me going and they
Mhm.
kept me busy. So I think I was very fortunate.
Okay. Well, that's good that you had all that support around
Yeah.
you. And it sounds like you're also like to be a very busy person,
Yeah.
which probably helped too.
Yep.
Now, have you had any partners at all since your husband passed?
Oh, no.
Okay. Okay. So, have you been sexually active with anyone
No.
since? Okay. And in your lifetime, had you been sexually active with anyone besides your husband?
No, just my husband.
Just your husband. Okay. Do you have any concerns about sexuality at all?
Not really,
Okay.
no.
Do you plan to be sexually active again in the
I don't-
future?
I am not, it is not something that I have even thought about.
Okay.
But I can't say that won't change.
Okay.
But right now, no.
Okay. And have you ever had any questions about your own gender at all?
No,
Okay. If you're comfortable with who you are?
no, I like being a girl.
Okay. And what about, so it sounds like you have a ton of support and you're not currently with anybody else.
No.
Tell me a little bit more about health habits that you've had. We talked about your diet and your exercise. Were you ever a smoker?
Yes, I was. I quit 35 years ago.
Okay. And how long did you smoke for?
About 20 years.
20 years. How many packs a day did you smoke?
One.
Okay, that's great that you were able to quit. That's wonderful. What about alcohol use? Do you drink any alcohol?
I wouldn't say I drink any alcohol on a regular basis. I may, if I'm out to dinner, have a glass of wine.
Okay.
Never more than one. And if I do, that's usually maybe once or twice a month.
Okay. All right.
So,
So not frequently.
no.
And do you use any recreational drugs at all?
No.
Do you use any drugs that are prescription for non-prescription reasons? No. Okay, good. All right, very good. Let me summarize because I got a lot of information from you. You are a retired school teacher. You're enjoying your retirement, have a lot of hobbies, reading, singing, swimming, volunteering. a lot of things like that. You have a great social support system, a lot of family and friends in the area to help you through tough times. Also, your religion, being Catholic, is very important to you, and you go to church regularly. You were a smoker. You quit years ago. Smoked for about 25 years, 35 years. Okay. You drink maybe 1 or 2 glasses of wine a month. No recreational drug use. You are widowed and you don't have any current partners. And it sounds like you're in a pretty safe environment. No history of violence or anything else. Anything else you think I should know about you?
Oh, I don't think so. I think that about sums up my life.
Okay. All right. Well, thank you for sharing all of that with me. So now I'm going to move on to the review of systems, just running head to toe, just to make sure we didn't miss any components of your health. Okay.
Mm-hmm.
Okay. So now you've watched the social history, and we're going to move to the last part of the medical history. The review of systems is essentially a list of questions that you ask to make sure that you have not missed anything on the medical history. It notoriously is a little bit tricky for first-year medical students because it is purely memorization at this point, as you have not really learned any pathology yet. How I usually start the review of systems is to say the following. I usually say to the patient, I've asked you a lot of information. I want to make sure I haven't missed anything. So I'm going to go head to toe and ask you about any issues or problems that you've had in the last several months. Okay? I'd like you to memorize a few questions for each system. Okay? This slide just has the systems listed. The video clip that you're about to watch with me interviewing Peggy will give you a little bit of a better idea of the different questions you might ask for each system. I want you to watch the video, and I want you to listen to the answers that Peggy gives and try to match them with the systems that are on this slide. Okay? I'll give you the answers at the end of the video, and you can see how your results match up. Good luck, and thank you so much for watching. So Peggy, now that I've taken a pretty complete history, sometimes people forget to mention things that are bothering them, so I'm going to run head to toe and just ask you about everything, okay? Mm-hmm. Make sure we didn't miss anything. Just generally speaking, are you having any problems with fatigue?
No.
Okay. Feeling hot or cold all the time?
No.
No? Okay. Any changes in your weight at all?
No.
Okay. Have any problems with headache at all?
No.
Any dizziness?
No.
Okay. Besides wearing glasses, have you had any problems with your vision at all?
No.
No. How's your hearing?
Excellent.
Okay. Any trouble with swallowing at all?
Only this sore throat.
Okay.
That's it.
Other than that,
No.
before this, you had no problems?
No.
Okay. All right. Any problems with sinuses at all?
No.
Okay. Any difficulty with chest pain?
No.
Any trouble breathing?
No.
Okay. You mentioned an intermittent cough.
Yeah, since I've had this.
Since this, but before that, you
No.
had not? Okay. Any problems with your bowels at all?
No.
You having any heartburn?
No.
Any abdominal pain?
No.
You ever notice blood in your stools at all?
No.
Okay. How about any problems with urination?
No.
Okay. No burning when you urinate? No,
No.
blood in your urine?
No.
Okay. Do you have any problems with vaginal discharge?
No.
Or vaginal bleeding since menopause?
No.
Okay. Have you had any problems with muscle pain?
No.
Have you had any problems with joint pain at all?
No.
How about any rashes on your skin?
No. No. But I do have this.
Okay, a little mole there?
Yeah, and
Okay.
it seems like it's getting bigger.
Okay, all right. When did you first notice it getting bigger?
I would say over the last few months. You know,
Okay.
it's one of those things where unless my hands are up here, it's hard for me to even think that it's there. But I noticed it. It's just a little bit.
Okay. All right. Does it itch at all?
No.
Okay. Has it bled at all?
No, because I try to keep my hands from it because I don't want to scratch it or anything. But
Okay.
yeah, I would like you to take a look at that.
Sure. I'll
Yeah.
take a closer look when we do the physical. Okay. That pretty much wraps up the questions that I want to ask you. So I'm going to have you get into a gown now. All right. I'm going to step out while you do that. I'll be back in about 2 minutes, and then we'll do the physical exam.
Okay.
Is that okay
Very
with you?
good. Yes.
All right.
That's fine.
Perfect. Thank you for sharing all that information with me.
Thank you.
Slide.
Say that right. This slide is an introduction to the review of systems. I want you to watch the video clip of me interviewing Peggy. You're going to hear me ask 2 or 3 symptoms from each of the systems listed on this slide. What I want you to do is match those symptoms with the systems on this slide and see if you can see where they fit. When I do a review of systems, I usually introduce it by saying, now that I've asked you your full medical history, I want to be thorough and I want to make sure I've hit on every single part of your history. So I'm going to run through from head to toe and ask you about anything that's been bothering you in the last 2 or 3 months. So now what I'd like you guys to do is just watch that clip and you'll see my answers following the video. Good luck and thank you for watching.
One thing.
This slide is an introduction to the review of systems. The review of systems can be a little bit tricky for first-year medical students, and that's because it's much more helpful to have a background in pathology when you're going through a review of systems. That being said, you will all get there.
How would you start it?
Okay, so I'll just say, review of systems can be a little bit tricky for first-year medical students, and I think that's because you don't have the background yet in the pathology. What a review of systems is basically a laundry list of questions that you use to identify if there's anything on the history that you missed. It's literally a list of symptoms that you ask a patient from head to toe. Okay? We don't do a review of systems on every single patient we see. We oftentimes do a review of systems when we see patients for a complete physical exam, or if they have a complaint that involves sort of multiple systems. All right? This slide basically shows you what the components of a review of system are. You can take a look at that. This is how I usually, I can say this is how I usually.
I'd start from the beginning of the slide. So
Okay.
This slide is, and then.
Okay.
And then.
This slide is an introduction to the review of systems. I don't list every symptom, but these are the main components of the review of systems. I don't think that's right. I think I say these are the systems that you're going to touch on. You'll ask a couple questions from each. That's what I'll say. Okay.
This slide?
This slide has a list of This slide has a list of symptoms. This slide has a list of systems. Okay. Typically, when I do a review of systems, I ask 2 or 3 questions from each system. I think it's a lot easier to understand if you watch the next video clip of me doing a review of systems on Peggy. I want you to list out the review of systems, which is just a list, and compare it to the one I've provided at the end of the video. Good luck. Thanks.
Can I do it one more time? Because I feel like the system and symptoms were like...
It's really hard to say. Okay. Do you want me to re-describe the review of systems too, or no?
I think just...
That was fine. Okay.
No, I mean like a full... Let's just do a full...